Mike Peck's contributions to the Lancaster community became very personal after an automated external defibrillator, or AED, saved his life 14 years ago.
Well, we've worked really hard for several years to get a program together that would identify all the public access AEDs in the county, and that is designed to let everybody know where an AED is and get it to the victim as fast as possible.
Mike's commitment to heart health includes leading the Lancaster Heart and Vascular Institute Mission Committee, as well as chairing the annual Wine Heart Gala, which raises funds for cardiac health programs and has placed over 180 AED devices in our community.
Joan Bobin, excellence in community service and volunteerism has kept her close to the Lancaster County community and Lancaster General Health.
It was a natural fit for me to volunteer for Lancaster General Health and the Pennsylvania College of Health Sciences. They're both very rewarding to me, and they are a positive influence on my life.
During her nursing career at Lancaster General, Joan's leadership helped advance changes in the care of women and infants, including the creation of a NICU, the Women's Health Pavilion, and a redesign of maternity care that would become a model for units throughout the country. Joan is a lifelong member of the United Auxiliaries to Lancaster General Hospital.
My experience with the auxiliary all those years was a really great experience. I was working alongside of many of the people that I sometimes volunteered with, and it was a lot of fun. It showed me a whole different dimension of what being a nurse, working at the hospital, being at the hospital could really be like.
Esther Schawbach began her volunteer service with Lancaster General Health in 1960 as a Red Cross volunteer. At that time, all volunteers needed to apply through the Red Cross, since Lancaster General did not have a designated volunteer department.
I moved from Strasburg to Lancaster in 1960, and then I started working. I was working at the newspaper office, and then I started doing volunteer work Monday night, and I walked to the hospital and walked home. It's rewarding to me. I like doing something, and I guess I felt it was something to do after work 1 night a week.
When Esther first started volunteering, nurses would call the Red Cross room to request help with taking patient temperatures. Much has changed since then, including the volunteer uniforms.
I think it was maybe 3-week training period before we got our uniforms, and then we had to work a certain amount of hours before we got our caps.
I've always had an interest in serving underserved areas in my career, and so I guess that's why I was attracted to family medicine. How I got attracted to Lancaster General was the fact that when I was a fourth-year student, I learned that they were starting a family practice program. And so since I enjoyed almost everything in medicine, it seemed to me that family practice is a natural to get into. So I was attracted to Lancaster General, and some could say that's because that's where I came from, but I think Nick Chavanis played a major role in my attraction. He talked the talk that I liked, and so I, along with a number of other colleagues, I think it was around 6 or 7 of us, came to Lancaster General in 1970, we were the first class to start the family practice residency.
So the Clinic for Special Children is a nonprofit organization set up by my wife and me in 1988. Its name, the Clinic for Special Children, uses a term that has been used within the Amish and Mennonite populations for a long time to designate the children who have inherited disorders. And those range from biochemical disorders like glutaric aciduria and maple syrup urine disease to forms of dwarfism that are well known within the community, and people in those communities just refer to those as God's special children, and that's where the name came from. Paul Waddell, who was the CEO of Lancaster General at that time, got in touch with me and offered help. First, LGH made available a little clinic in Willow Street and helped set up a lab there that allowed us to start taking care of patients immediately in 1989 and 1990. I became part of the staff of Lancaster General, and the nurses on the pediatric floor just took a great interest in the patients that I admitted there and in the diseases that we were treating. Over the first 10 years, Lancaster General became a major treatment center for inherited metabolic diseases. We had more admissions to the pediatric floor at Lancaster General than busy services like Children's Hospital of Philadelphia or Hershey or any of the regional hospitals. So we took what many people would consider a community hospital that wasn't really oriented toward genetics and metabolism, and we developed services within that hospital that were really better than any of the regional academic medical centers, just simply because we had a lot of experience. It became an important service that didn't exist and then did exist after 10 years.
Seth Worley also brought a new specialty to Lancaster County in the late 80s and is still innovating today.
I came to Lancaster in 1987 to join Cardiovascular Associates of Lancaster. And I was recruited here from the Mayo Clinic to start the electrophysiology program. And at the time, there were no electrophysiology programs outside of the academic medical centers. And the group at the time recognized that electrophysiology was going to be a mainstream activity in the world of cardiology, so that I was recruited here to start the program. One of the things I'm most proud of is the Lancaster Heart Foundation, which was formed by the Heart Group, which at the time was called Cardiovascular Associates of Lancaster. And the Heart Foundation had two purposes. One was to provide support for clinical trials, and the other was to provide community service.
While with the Heart Group, Seth found a way to use his interest in electronics to develop better tools for inserting pacemaker leads.
And as a result of that effort and the effort of the people that I worked with, and they were always coming up with ideas and suggesting things and trying to provide this service to the patient, trying to get that wire where it needed to go. And as a result of that, I started hand-shaping catheters and coming up with different designs to be able to get the wire where it needed to go. So I finally found somebody to make it for me, and that's sort of how I ended up developing a set of tools to put the leads into proper position for patients, because I knew how much better the patients would do.
In 2005, Megan and Todd Brown were devastated by the stillbirth of their second son, Carter. They knew they would honor this beloved child and channel their sorrow into something that would not only preserve his memory, but also help their family cope. That something would be Carter's Corner.
Carter's Corner is a place at Women's and Babies Hospital for children to make crafts, play games, read books, while their family or mom is in the delivery room with a new sibling.
It was something that was more personalized and unique to our family, because its inspiration was our oldest son, Andrew, who at the time of Carter's passing was 2 or almost 3. And he loved to craft, and he created a gift for his sibling. When you lose a child and you process that, it was an opportunity to channel our grief, to have something that was unique to our family that also provided, help to the community and to the hospital. Selfishly, it started out to help us, but it didn't take long to obviously realize the other benefits, to children, to other families, to the hospital, to the community. It continues to help us heal today and to grow as a family.
At times I felt very alone, we both did, and having this project to be able to work on together brought us together during that time where maybe we grieve a little bit differently. He was more of the task man. I was more of the, private griever. But then we came together for this project to get it underway.
This award dates back to probably the inception of the foundation. This was a brainchild of Tom Beeman, who wanted to recognize and validate people's contributions to the community and to Lancaster General. Having been on the foundation board and having been on the board of Lancaster General, I've seen this award over the past 10, 11 years. I've seen the recipients of this reward over the period of time, and it is unbelievable to consider myself in their company.